To the world, you might be one person, but to one person, you might be the world. You've probably heard this quote before, as it often appears on motivational posters, usually accompanied by some flowers or a carrot. However cliched it may be, it accurately summarizes the struggle between the culture of life and the culture of death. The culture of death can be a hard thing to define, but the best definition probably is that it's the philosophy that people don't matter. The only thing that matters is what people can do, and their worth is defined solely by their abilities. Every person is just one of many, easily replaced. This philosophy of utility is expressed a number of ways, from abortion to assisted suicide to infanticide. First, we will examine these expressions and understand why they are incorrect, before discussing the most effective way to combat them. I'm sure many here are familiar with abortion and its devastating effects on basically everything. Although it's been said, I will say it again. Abortion murders a child and degrades a woman. Both the theology and biology agree that abortion is the deliberate killing of a human person. That contradicts every bit of what reason and natural law reveal to us. While we realize this, not all people have the privilege of an educated conscience yet. Some become confused while the child is still in the womb as to the child's exact state of personhood. However, there should be no confusion that a baby that has been born healthy and alive clearly is a person. It seems like ludicrous that infanticide is even being discussed and unfortunately legalized by radical politicians across our country. Another absurd yet tragic matter at stake in our country is the matter of assisted suicide. Some believe that rather than treat an ill person's disease with dignity and conviction, the easiest thing to do is to simply show them mercy and release them from their pain. Or in other words, kill them. One of the scariest things about assisted suicide is how it treats doctors. Rather than helping them honor their oath and use their skills for healing, some states have passed legislation that removes the doctor's right to not perform these procedures. Assisted suicide is a betrayal of both patients and physicians. Although assisted suicide usually refers to terminally ill patients, there can be pressure on the elderly as well. This is more specifically called euthanasia, and it is just as wrong as all these other hallmarks of the culture of death. No human person should be seen as a burden or pressured to feel like everyone would be better off without them. The culture of death is focused on utility, what a person can do. If a terminally ill patient can no longer walk, the culture of death no longer sees them as valuable. A preborn baby who has yet to learn how to speak is another target because they are completely dependent on their parents and the people around them. The elderly and infirm are no longer seen as useful if they don't have a career and contribute to society. But there's so many ways to contribute to society that don't depend on employment status. Just the presence of any human life in this world is a gift because every human life touches the people around them. The culture of life is the exact opposite of the culture of death. It seeks to uphold the dignity of every human person, regardless of age, ability, or circumstance. Now, this is a nice saying for the picket sign, but how does one actually practice the culture of life? Not all of us can be leading the charge for life in the halls of our government, and quite frankly, many of us lack the connections to make a gigantic change in the world. But remember the motivational quote, even one person can be someone's world. The culture of life isn't built in dramatic steps and leaps. It's built in small smiles and kind words. Wave at your neighbor as they drive by. Acknowledge them. Put your phone away when you're speaking to someone and engage them. Volunteer at a soup kitchen. Pro-life means from conception to natural death and everything in between. Visit a nursing home or drop off a box of diapers at a pregnancy shelter. Smile at a lonely person and invite them to eat lunch with you. And see them. Affirm the dignity of every person you meet with your words and actions. By taking these small steps to let the people around us know they matter, we can alleviate some of their suffering with true compassion, not the false mercy preached by the culture of death. The most effective way to build the culture of life is to love every person we meet and let that love spread. See each person for the adorable little baby they once were, and respect them for the wiser person they will become. Though it might sound trite, the truth is that love is the most effective strategy for advancing the culture of life. Making the choice to support the people around us, the mothers in crisis, the newborns and the young children, the elderly and ill, and in turn helping them support others in their trials, is the way to build a true culture of life.